Welcome to Adapting Place. This is a quick question to master some test taking strategy and NCLEX review. So let's get to it. Very short ones, interesting one, just to I set 5 questions to show you different ways of when you're seeing questions, what you need to do, right? As usual, read the question from the back, right? Which of the following the novice nurse will select as right to left shunt? That's the buzzword. Right to left shunt. You have to learn how to answer questions by just focusing on the buzzwords. Right to left shunt, that's your buzzword here. The next, provide teaching to a novice nurse about congenital heart disease. So that's all. Congenital heart disease, which one is right to left? You have to figure out. There's a way you can remember. There's a right to left and left to right, right? Right to left, most of them are cyanotic at birth. Left to right, they are not. The best way to remember is right to left. Most of them start with the letter T. Which of these start with the letter T? Even if you don't know, you can see that there's only one of them that will cause cyanotic because of the transposition of great vessels. This does not start with T, none of them. But this is the easy way you can remember them. They are not that difficult. You just have a strategy you can remember these congenital heart disease, and then this is right to left. The rest of them are all left to right, and they don't cause cyanotic. They are at birth. The next one is another strategy, just to show you some of these things. Only few words will help you answer the question. There's nothing to magic answering questions and focusing on the keywords. That's the clue, the cues, right? You focus on the cues and then you analyze them. Which of the following the nurse should consider as a possible cause of the alarm? What is the problem? A nurse is caring for a client on mechanical ventilator for acute respiratory distress syndrome. This is all irrelevant. I've not asked you anything, so don't worry too much about what is ARDS. It's irrelevant. The ventilator triggers multiple low pressure alarm. That's the key. Low pressure alarm. That's all you need to focus on, low pressure alarm. So they asking you which of this would generate a low pressure alarm. That's all. If you do that, these 4 lines are turned into 2 words, low pressure alarm. And then you know ventilator is a circuit. This is the patient. This is the ventilator. It's a closed circuit. If there's a blockage, things goes up. If there's no blockage, things go down and you develop low pressure alarm. Which of this is causing blockage? Which of this is not causing blockage? If you're causing blockage, you're going to increase the alarm. Pneumothorax is a pressure in the system, right? Therefore, this will generate high pressure alarm. Self-extubation means there's no tube connected to the patient. Therefore, all of it will be low pressure alarm, right? Kink is the same as pneumothorax. I'm generating high pressure alarm. So it's wrong. If you read the question wrong, you're going to get it wrong. The answer question say low pressure alarm. If you choose 3, then you're not reading the question right. Kink tube is a pressure. You're creating more pressure. When you kink the tube, there's pressure. And a patient who is biting the tube is a pressure. If you choose 3 and 4, you are not reading the question right. The question say low pressure alarm. Once again, low pressure alarm. Therefore, don't choose number 3. There's a reason why I said it. It's for you to, we call it attention to detail and focusing on the keywords. It's a low pressure alarm. 3 is not low pressure alarm. Biting the tube, you are increasing the pressure. Mucus pressure plug is another increase in pressure. Anybody who selects 3, 4, 5, you are not reading the question right. And you have to pay attention when you answer a question. You know the answer, but you answer it wrong, right? Leakage, that means there's no connection. There's leak, so pressure will be low. So 6, low pressure. 2, low pressure. The rest all generate high pressure. This is test taking strategy, paying attention and knowing what the question is asking you. Don't just answer them, right? Same thing, test taking strategy. Which fluid choice is the most appropriate for this patient? And let's provide care for a client with serum and sodium of 155 milliequivalent per deciliter. Don't answer the question and just go and pick an answer. Look at it. Serum sodium is what? 155. Therefore, I have what? Hypernatremia. Sodium is too high. What do you think? If you have sodium that is too high, which direction would you go? Do you want to go up or do you want to go down? That is the key. Do you want to go up or down? That's your decision you have to make. The test taking strategy, you know that, I don't know why you have to go up. It's already up. Do you want to go up? No, don't go up. So even if I don't know this answer, I'm going to choose something that will bring me down. I know it's 155. I got to go down. Then you look at the answers. 3% sodium, half normal saline, 0.9%, D5 dextrose, and then 0.9%. Which one is making you go down? Think about it. I have to give you something to bring your sodium down. Which one, if I give you, will make the sodium go down? I can tell you if they give them 0.9%, it's bad. It goes up, right? If you give them 3%, you're killing them more. It's way, way up. 3% is way higher than 0.9%. So it's a wrong answer. Once again, test taking strategy. You're trying to calm down. You can't give them anything more than 1%. Don't give them anything more than 1%. This is fundamental. So which one is less than 1%? Number two. D5W and 0.9% is hypertonic fluid. This is adaptant class teaching you how to answer the question. There's no magic to it, but to pay attention to the keywords. That's the buzzwords I said. And then use your content. And if you need content, then you should check adaptant class. Or you can go anywhere you want to get your content. Go to a place that will give you something that you can use it. You don't just memorize and watch video, but understand that if my sodium is 155, there's only one direction I will go. I got to come down. And that down is to be normal. And if I'm coming down, I'm picking anything less than 1%. If it's low, I got to go up. And I have to pick something more than 1%. So 3% is a wrong answer. And this is another one. I put a word there. Most people have never seen it before. Which finding is most concerning, right? And let's provide care for a client with what? Mucoviscidosis. If you don't know what it is, it's okay. You can still answer the question. But if you know this, the answer will pop out like a candy. Who know what this is? Mucoviscidosis. Who know what it is? Who know mucoviscidosis? What is mucoviscidosis? But even if you don't know, let's break the word down, right? Let's break down the word down. Muco, so something mucus, right? Something mucus, right? It's very viscous mucus. Which disease process do that? That you know for your boards. That you need to know. It make a bunch of mucus. It's very thick, and it make a lot of secretion. These are another name for that disease process. Mucoviscidosis. Who can guess? It make a bunch of mucus, very thick, and difficult to excrete. That's what it means. What do you guys think? Mucoviscidosis. This is cystic fibrosis, another name for cystic fibrosis. Now that you know, I give you the answer. That's another name for it. Cystic fibrosis. Which of these do you think is bad? Excessive thick blood and thin sputum, saturation of 89 in room air, enlarged voluminous stool, and an albumin of 2.9. This is what I call B sharp all over. This is B sharp all over. Be sharp. You have to be sharp and think, and don't let the board trick you. Don't go with the unexpected finding. If this is cystic fibrosis, mucoviscidosis, which of those, and they ask you for most concerning, then you should not pick unexpected finding associated with that disease process. Which of those should be concerning to you? Think about it. Which of this should be concerning to you? Tell me. Which of this is concerning? What do you guys think? Give me your best shot. Hit me. Hit me with your best shot. And let me see how you're thinking. And I can explain to you why it's not what it is. Mucoviscidosis. Which of this is very concerning? You know it's cystic fibrosis. Which of this is very concerning? It's a test-taking strategy and thinking and being sharply said, I'm not going to look at something that is an expected finding. I don't know. There's so many prioritization over there, but trust me, just find something that work for you. But if you think you know it, you're not going to pick albumin of 0.9. These guys are more nourished, right? You're not going to pick number 3. They have large, fatty, voluminous stool. You're not going to pick 1 because I put blood thin sputum. Of course, he's going to have excessive thick secretion, and this will have a little bit of blood in it. This is not CHF. Don't pick it. ESAT is not normal. You don't see desaturation in cystic fibrosis. That means he's getting into trouble. Therefore, number 2. But don't pick number 1. Okay? Don't pick number 1. And the last one. Of course, I can't live with prioritization. You got to be sharp, right? Which client should be seen first? And then receive report on assigned clients in the emergency room. One had an alcohol a few minutes ago after taking Finax in 24 hours ago. He has tremor and insomnia after taking metafenidate. He has diarrhea and vomiting after taking escitalopram. Drooling after taking clozapine. Mental health is my favorite. And I can trap you any way I can with questions about mental health. If you need help, check mental health on adapting class or pharmacology. It's just straightforward, confusing, but if you get the concept right, this is a trap. I have traps all over, and I put bad stuff there. So, which of these are you going to pick? And let me know the answer. Which of these, who are you going to see? If you are the nurse, once again, what is B sharp? You have to be sharp as you select the answer and tell yourself, is this what I expect in this patient when I take this medication? If that's what you expect when you take this medication, then don't pick it as an answer. But if you don't expect it, then pick something else. Once again, if this is what you expect when you take this medication, then you should not. 5 questions. Thought-provoking, stimulating for your mind. Adapting class will be out. But I will explain it to you. This is bad. These MOIs, right? You should not be drinking, right? But it's 24 hours. If you're going to be sick, you'll be sick by now. So don't pick number 1. I know it look dangerous, but it's 24 hours. Why would he be sick? Metafenidate is a stimulant. If it's a stimulant, you're going to have tremor. You're not going to sleep. Escitalopram, right? This is SSRI. If you take it, you're vomiting, you have diarrhea, you have serotonin syndrome. bad. Clozapine is what? Second generation antipsychotic. What does it do? It causes hypersalivation. What is hypersalivation? You're going to draw. Drawing is not airway in this situation. Therefore, serotonin syndrome is bad. This is adaptant class.